Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA County. NALBA is a nonprofit agency dedicated to the well-being of Latino individuals, families, and communities in California and the U.S. Our mission is to address the disparities and barriers affecting the behavioral health of Latinos. Today, we're excited to present our Pláticas series called Take Action LA County on reducing stigma and the barriers affecting the behavioral health of Latinos. So we're very excited because this Plática, which means conversation in Spanish, is to have a conversation with our presenter, and I'll be introducing her in just a little bit. NALBA would like to thank the County of Los Angeles Mental Health Department for making this series possible. Each month, we are hosting guest speakers, and we are having them join us to talk about the importance about mental health services and to have them share their own story. And more importantly, is how it is that people can receive services from their agencies. So please join us each month for this Plática so we can be able to be of service to your community and the needs that associate with mental health. So let's begin, and I'm going to introduce our wonderful presenter. So I have had a chance to read her bio, and all I can say is, oh my goodness, we have someone here who's just a jewel, and I want to be able to make a formal introduction, and then after that, I'm going to have her say a little bit more about herself, because it'll be a chance for us to get to meet her, and we want to make sure that you know that in this Plática, while it's live, we're also going to record it and then replay this so we can share this so more people can hear about this particular Plática. So again, let me welcome Margarita Alvarez Gomez. She's the executive director for the Central City Neighborhood Partners, CCNP for short. Mrs. Alvarez Gomez was raised by a single mother and an immigrant from Mexico. She came to Los Angeles when she was 18 years old. She's married and has 3 adult children, 1 grandson and 1 granddaughter. Abuelita, very cool. Her community engagement is a testament to her upbringing and her mother's community engagement. So it's telling you about something that rubbed off, right? But more importantly is Margarita has been working in the nonprofit sector for over 20 years. Very important. She says she's very passionate about supporting the community and has done so through various initiatives. She has been working in such a way that she's dedicated 12 years to the Central City Neighborhood Partners program. And as part of those 12 years, 5 as the executive director. So she's moved up that ladder. So that says a lot about her abilities, her experience, and her expertise. She's very committed to serving the families that are in what is the city of Los Angeles and who are living not only in District 53, but even beyond. She works in such a way that's very tireless, and she's very committed to providing services with the level of dignity that supports communities. She's supported by a whole team of folks behind her, right, to be able to do this work to advance economic opportunities for individuals with lower incomes and fostering partnerships around the community with different agencies. She holds a degree in human resource management and is a graduate of the Whitecap Foundation's Executive Management Academy. She's also received the California Award for Performance Excellence from the California Council for Community Excellence. That was a tongue twister. That was trabalengua there. Did you see that? That was like a lot of words in a short period of time. Anyway, in 2019, she was honored as Pioneer Woman of the Year for the city of Los Angeles. And this was in Council District 1 and the Commission of the Status of Women in 2022 as Woman of the Year from the California Legislative Women's Caucus. All I can say is we have someone here who has shaken, moving, and served her community well. I'm just very honored to have you here with me, Margarita, if I can refer to you by your first name, because I think we can make this a very personable conversation. Es una plática, ¿verdad? And all I could say, what a bio. I was going to say, man, they're going to write an autobiography about you. I can just imagine. I can already hear Somebody's going to be doing an autobiography. But anyway, tell us a little bit more about who you are. Porque I know the bios tend to have like this official kind of language, pero ¿quién eres? Say a little bit more about yourself, and let's start our plática.
Thank you so much, Fred. That was a long one, but I have to say that all the work that we've done at CCMP has been a team effort with the CCMP team, as well as our partnerships throughout the city of LA. We have many people, many agencies that has helped us do the work that we do. And just like in our name, Central City Neighborhood Partners, we do the work that we do in partnership with not just community-based organizations, but also our representatives, people like you know, from other organizations in other states that help us bring not only the education to our community, but also the information they need in order to thrive and be successful. I always talk about, I wish my mom would have known of this service. I mean, I didn't grow up here in the US when I was little. I lived in Mexico, and we didn't have all of the resources that we offer here. But coming to CCMP, I just fell in love with the community, and everything we do is to ensure that not only the parents and the grandparents, because we serve a multi-generational families. So it's not your typical mom and dad and the children. We have the tios, the tias, the grandparents. And what we aim to do is provide the adults the education, but also the children, offering them the opportunity to see other things. You know, a lot of them have never moved or seen other places other than the Westlake area of Pico Union. And so we try to take them to other places, go see the beach, go to the mountains, go on field trips to the universities, so that can be an option for them should they want it. And that's my passion. I believe that with education and information, you can really make a difference in your own life. The service area where we're at is almost an open door, I call it, an entry point for a lot of immigrant families from Mexico and Central America. And so a lot of them come to CCMP as a first resource of information. And then from there, our aim is to educate and as many things as possible.
Wow. Wow. You know, I can tell that, as you said, when you fell in love with the work of the organization, that that's such an important thing to say, because when we feel passionate about the work we do, then the people who we serve benefit from that. And clearly, people have noticed how much you have had an impact in your community. And so you probably draw in partnerships and into your space very easily, because people know that you're a good partner, right? That you say what you say, you walk the walk, you help people who come to you for services. But como se dice el dicho, que una mano lava la otra y las dos lavan la cara.
Right.
You know, so for our English audience, one hand washes the other and both hands wash the face. So it's a reciprocity, ¿verdad? Entre los dos juntos estamos ayudándonos uno al otro. So together we're helping each other as a partnership. So this is really great to hear that approach and that philosophy. So now, here I get to ask you, tell me about the services that you provide. So what we want to do is have our listening audience learn about your services, because then at the end of the interview, we want those people who are listening to come connect to you for services. And so we want to bring those two things together as part of this plática. But let's start by learning about the services you provide. And I'm excited to hear about it, because some of the work you do is taking care of people's most important needs. But Margarita, please.
Yeah, so we serve specifically the city of Los Angeles, people who live in the city of Los Angeles, and we know that's huge. But we do have some services that We also serve the county of Los Angeles, and that's the majority of the services. CCMP is located, as you said, right in the heart of Westlake and Pico Union, the Pico Union community, Council District 1, Assembly District 53. And so we have people from all different walks of life coming to our center. And we are in the city of LA, there are 16 family source centers. We manage the Westlake Pico Union Family Source Center. And so we service anyone who lives in that area with case management, parenting, college corner, just many services that will help the family thrive, not only financially, but also for the children academically. In the last 3 years, we also have grown our food services program, and I'll talk a little bit more about that. Since this year, and as a result of the pandemic, the city of LA funded a program called the Peace and Healing Center, which aims to provide services to people in the mental health, because we realize that a lot of our families don't seek help when mental health is needed. It's, you kind of mentioned it a little bit at the beginning, it's taboo for us. Like, no estoy loca, I'm not gonna go, I'm not crazy, I'm not gonna go to seek mental health. And one of the things that we do is provide a safe space for families to come and seek that help. While we're not a direct provider of mental health services, we link people to other agencies that offer that. But initially, what we want to do is offer a place where families can come and take time away. I call it time out for parents, because a lot of our parents live in multiple families in one small space. So you don't have no privacy, no time to, even on the voice of some of the youth that come to College Corner, we have many quotes from youth who say, CCMP is my home away from home, because I can come here and have a private space where I can read, do my homework, or just listen to music. And we provide that for parents as well. In the Peace and Healing Center, we have spaces where people can just come and meditate or read a book and be on their own. The space is big, so we don't have a lot of people there, and you're able to then just be yourself for a minute away from the busyness of life. We also offer other guided meditation, yoga, Zumba, and then healing through art, we call it. So they can come and they can do poetry, or they can paint, just to get those feelings out. Also, I don't know about you, but I know that it's really hard for me to talk about myself, or to say, I'm not feeling well, not physically, but I just don't feel like myself today. And it's recognizing that that's a mental health issue. Or even when you're sad, sometimes you don't know that you're sad. But when you come to this space, you're able to recognize that. And it's not only you come and you take those services, but what do you do after that? And if they seek a referral to, to go see somebody in the mental health field, then we have those referrals that we can do a warm handoff to those places as well. And then it's up to the family as to whether or not they want to follow through with that. So that's on the mental health issue. Then I've always said that if you have a lot of problems, whether it's your family, mental health, or you don't have a job, or housing is really hard, but if you don't have food to eat, then the problem becomes even bigger. And I believe that when you have food at home, everything else becomes easier, because at least today you had food for your family. And so through our food services program, before the pandemic, we used to have a small program. We serve about 100 to 150 families weekly. We now serve over 1,000 families weekly.
Wow.
And
wow.
yeah, We offer not only the dry goods, but we make sure that we also have fruits and vegetables. Um, Many times we're able to then purchase milk products like cheese and butter, bread, to ensure that the family has a full array of food. And I believe that as long as you're fed, everything else just becomes easier in your life. And that I've been promoting that a family who's fed is able to just do anything. And that has been one of our core services for families. And they come, and so we have a program called Thursdays at CCMP. And on Thursdays, any Thursday from 10 to 1, whether it's raining or it's cold or it's sunny, the team will be there to distribute the food. And for this program, and it's the only program that we don't ask any questions. So, well, we do ask your name and then family size, but there's no eligibility requirement or nothing. As long as you need the food, you can come, you line up, and you receive whatever we have for that day. We do offer other services to augment, if you're coming for food, we've had offer vaccinations, flu shots, COVID testing, nutrition program. We have a waiting line for that. A lot of people, I didn't know this, but I found out that clinics charge for nutrition classes, especially if you have like diabetes or hypertension. Families were coming to tell us that some of the clinics were charging a fee for taking those classes. Well, CCMP offers a 7-week class where you receive, every time you come to the class, you also receive the goods of the recipe for the day. And then if you attend all 7 weeks, then you get a prize at the end. So that has been a very successful program because not only, one of the things that we are known for, and it's something that we educate our team on, is that when you are offering free services, we're not giving you anything. We treat you with respect, and we are decent, and we're with loving care. So when you come, you don't feel like you're less than because you're coming for food, but it's more as this is a service and we care about you. You need it. We're not going to make you feel that you're here to ask for a giveaway, but it's more a service that I'm willing to do for the community. And if you want to take advantage of all the other services, then you're welcome to do so. We do have several partners with the food services like Los Angeles Food Bank, Feeding Families through the SAM Foundation, the United Way. So again, is the partnership that is making this work. Our council office has been of great help as well. And that's why we're able to reach this many people. I mean, we've had the schools calling us that they have families who didn't have anything in their pantry the next day and they didn't know what they were going to do. And so you don't have to wait for Thursday. If you all of a sudden run out of food or you lost your job and you have no money to purchase food, you can call us. And, even if it's not a Thursday, we're not going to let you go hungry. We've had an instance, we had a family reach out through Facebook on a Friday night, and the team that was working that night said, "What do you need us to do?" And one of the team members even put together a bag of groceries for the family and deliver it to their house. We don't do that often, but when it's an emergency like that was, our team is willing to do the extra mile to provide those services.
Wow. Well, Margarita, all I could say is I could see how the community would depend on what you do, because part of that is, I think you said it best, right? If you eat and you take care of one of the most basic needs in a people's situation, they feel well enough because they're nurtured, they receive nutritious food, and it just makes it easier to go to bed, with your belly full, como decimos, as we would say, right? But when you said 1,000 people a week, that would be 52,000 in a year.
Yeah.
And some of them may be duplicated, but there'll be many new people. But the fact that you're doing just that one program in a way that impacts that many people, and you add all your other programs, my gosh, like you are dealing with a large number of people who you're supporting. And
Yeah.
actually, when you were talking, you reminded me of a saying that they're using pretty common today. They're referring to food as medicine.
Mm-hmm.
So comida es medicina, basically, right? Is food is medicine,
Yeah.
and it's true, right? It heals you, it warms you, it nurtures you, and it provides you nutrition. It's the sustenance we all need to survive. But
Yes.
I was so glad you described all of that, and particularly when you talked about mental health,
Mm-hmm.
you know, and salud mental, no, or el bienestar, right? Because if you
Yes.
think about el bienestar de cada persona, if you think about the well-being of each person, that talks about the balance between the physical, emotional, and spiritual well-being of a person.
Yes.
And you clearly are touching that part of people's lives. So kind of walk me through. Let's say uh, I I lost my job, and I'm getting worried now about how do I pay the rent and how do I pay the utilities. Then I have to go deal with the government agency to go get the SNAP program or the WIC program, and I'm just starting to get worried. I'm stressing out. I'm starting to get a little moody at home. Y quién sabe qué. But here we are, right? We have a person who's been put in a difficult situation. No tiene trabajo, doesn't have a job.
Yeah.
Oftentimes, COVID kind of pushed people out of jobs,
Yeah.
and it left people without financial resources, ¿verdad?
Mm-hmm.
So, but because I'm coming in and I tell you my story, there's really a story about a person who's experiencing some, pain, distress,
Yeah.
¿verdad? They don't feel well emotionally, and then it physically starts to take its toll.
Yeah.
So, how would you address the emotional aspects of a person in addition to the things you provide services for? Porque walk me through that. What would that look like? This
Yeah.
way, people could say, "Mira, she was telling Fred how to get help in the program, and if
Mm-hmm.
that's what's involved, I want to go. Porque ves, mira, look what she did for him. She gave him a roadmap." So
Yeah.
walk me through that.
Yeah. So our core services are over for the city of Los Angeles, people who live in the city of Los Angeles. However, if you live in the county, we don't just say, "Oh, well, you live in the county," but I'll walk you through our how we will address that. You live in the city of Los Angeles, you lost your job, and you don't have any savings. So immediately we'll ask you, do you have food at home? Because again, that to us, that's the basic need. Then if you are, we do have funds from different entities that were able to assist people with paying their bills if they haven't paid the bills in a while. Unfortunately, people come to us when they're at the limits. They don't come to us to prevent it, but it's more like, I'm dying here and I need this today. And as you know, everything, even though we're not a government agency, there's a process that we have to follow. So you call us and we bring you in, you meet with one of the wellness coaches. We have a wellness coach as a case manager or a financial coach. They will do an assessment of your needs, not only financial assessment, but also your other needs. One that has been completed, and of course you have to bring in documentation, because if we're going to give you money, we need to prove that you do need the money. And then we'll figure out how much we're going to be able to assist with as far as financial resources. So then we're able to pay your landlord. Your landlord has to agree to receive a payment from us. For your other, like electricity, gas, and water, we're able to pay directly to the LADWP or the gas company, but they have to bring the bill in, and we'll pay that directly if you're eligible for the services. and if the case manager, the wellness coach, will then assess for entire needs. So the kids need an IEP from LAUSD. Are they going to school? So we don't just address the need that you have as an adult, as a parent, but the needs of the entire family. And yeah, and then from there, if you need somebody from LAUSD, we do have somebody, a staff person on site that meets with the family. And then if you need mental health, then we'll refer you to mental health. If you need WIC or SNAP or any of those public services, our case managers are able to also help you fill out the application right there and there. And if you have all the documents that they need, then we upload them onto the website. And then sometimes the process is a little bit faster because you don't deal with the county office, or, we have dedicated staff that does that. Again, we'll walk the person through and offer them, these are all the benefits that you're eligible for. A lot of times the families don't want to apply. We have all the information, and we also have to assist them with the fear that they have of government agencies. There are many times that they just don't want to apply for anything, and they just want to. So if you're looking for just to get help with food, we're able to do that. And then we'll explain the benefits for your children. So you may not be eligible as the parent, but if you have children, the children may be eligible for these services. So we explain that as well. A lot of times it's misinformation that people may have, and we'll walk people through the process. But again, the first thing that we'll need to find out is whether or not you live in the city of Los Angeles. And if you live in the county, you'll be eligible to get the food. We are also a tax preparation site where families can come and get their taxes done for free. And we are year-round tax preparation. So if you haven't done your taxes, you have until October 15th to do them. You're welcome to come to CCMV and get them. And you have to make an appointment, and then there are documents you have to bring in to do your taxes. But you don't have to live in the city of Los Angeles for that. So the more specific, financial assistance for rental, for bill payments, those you have to live in the city because of the funding sources. But again, there's other agencies that may be able to help you. So again, when you come to CCMP, you're not going to leave empty-handed. We're going to provide you the resources that you'll need to find the resources. Sometimes we'll make the phone calls. We may have had people that just needed a piece of paper filled out because they didn't have anybody at home to fill it out for them. So then they'll come and we'll help fill out any government paper that for whatever reason they don't have anybody at home, and they'll call us, and we'll have somebody help you fill out the form. So we do that as well. So it's whole family well-being. It's not just one individual service. So I can only do that for you here. You're gonna have to go through three other agencies to do it. We'll try to make it so you only have to come to one place, and we'll take care of everything for you there. And if not, then guide you on how you can get to where you need to get.
Wow, beautiful. Your organization's willing to do things that many other groups don't do.
Yeah.
And the reason why is because of what you said, right? You said, we're here to help you with what you need. And that means that the person can come to you without feeling shame.
Mm-hmm.
The person can come feeling that they can get the help that they need. And then you want to assess their situation to look at it in a way that's helpful to the person. Mm-hmm. So it doesn't make them feel bad, or it doesn't look to say, hey, something's wrong with you. But anyway, what's important is you're willing to help the person just in the way that they present their situation. Because, mm-hmm. people feel vulnerable, but then how do they feel they can trust us? And how do they know that, that when we do leave, that when they do leave the building, they can say, "Sabes qué? You know what? I'm glad I came."
Yeah.
Uh, and because that means the male, the father can say, good, I feel good. Now my kids can eat and my wife
Mhm.
doesn't have to stress out about how we're gonna take care of our kids. And he
Mhm.
can feel like honorable to be able to say, look, pedí ayuda porque como decimos que una mano lava la otra, right? And
Yeah.
we're there to help each other. And it's a helping hand, basically. You are a
Yes.
helping hand. So just incredible. So I want to touch on a subject that probably isn't the most popular subject in the world, right? But it's a plática, right? We get to talk
Yeah.
about it because part of it
Mhm.
is it's something that we experience anyway, right?
Mhm.
So and we commonly hear it as stigma. And stigma is this label that this burden that people put on us because of something having to do with a mental health condition or a mental
Mhm.
illness. But somehow it's as if though that that's something bad. Well, the truth of it is all of us experience mental health issues. Either it's situational, in other words, it happens and it passes, or it's
Yes.
chronic. It's a condition that's serious and it impacts our lives seriously. But why would we abandon people who are experiencing difficulties? What you just said was, we're here to help people. We're not here to shame them or stigmatize them. See, that's the contrast, right? Lo que están haciendo and what people are experiencing, because
Yeah.
our country has done this stigmatizing. The country has emerged in a way that sometimes our systems are the most stigmatizing things. And then
Mhm.
people don't want to stigmatize or associate it with that problem or that illness. And then there's our own cultural perspective about, what happens if we do know somebody who has a mental illness. We have our own labels for people, right?
Yeah.
Or
Yeah.
we describe
Mhm.
no se le prende el foco, o se
Mhm.
le fueron las cabras. We have a whole bunch of ways we stigmatize our own people, right?
Right. Right.
Uh, anyway, how does stigma look like when people come to your organization, and how do you deal with it or confront it or help people minimize that? Because you're not stigmatizing people. You're doing just the opposite, right? You're saying the door is open, está abierta la puerta. We're here to be of service to you. We're here to help you. The stigma prevents people from getting help.
Yeah.
So kind of walk me through that, Margarita. What does that look like at your organization?
I think part of the work that we do at CCMP is that, so for example, on the mental health, we don't say, oh, you need to go to a mental health provider. We bring in workshops where we do a presentation, and we have actually worked through the LA County of Mental Health and the health department, where they send out facilitators and they talk about the different situations or the different feelings, and they also offer resources. So they said, if you ever have felt this way, this is where you can go. So I'm not telling you that you're sick. I'm not telling that you have a mental health issue, but it's more, this is the different situations that you may have, and this is where you can get help for that should you want it. And then we have a navigator at CMP that, if I go to this workshop and then tomorrow I come into a situation that reminds me, and then, oh, but the workshop was yesterday, but now I know that this navigator is there and I can go and ask her a question regarding yesterday's presenter. And then we'll have the resources or the information that they may need. So everything that we do is very respectful and not asking you, well, why are you asking me that question today? But on the contrary, so we'll do a general presentation, and then whoever needs that assistance will then come and seek it. As opposed to just saying, oh, we have a provider here today, go to the room and go get help. It's not done like that, because then people are not going to do it. We had a conversation with someone from Sacramento, and we were talking about the different effects, and then how do we deal with insurance when there's a mental health issue. And one of the attendees was a young person that said, I wish you guys will do a workshop on this to my parents, because my parents don't believe in mental health. And when I was younger, I really needed to go to a mental health provider, but my dad said, si no estás loca, where are you gonna go do that? So then that's how we began having these workshops, because of that situation. And we said, we really need to open the mind of the parents, especially older parents, because we don't believe that why are our kids sad, or why are they depressed? We don't understand that concept, but there's so many stressors for our youth nowadays. And as parents, we need to understand that. But I'm not going to understand it if I don't have somebody else telling me what are the stressors of our youth today, that they're depressed or they're overwhelmed, all those feelings. And sometimes it's really hard for us to speak to our youth because of that, because we don't understand. So when we talk about, feeling shame, or feeling like I'm labeled as a bad parent, or that I have a mental health issue, is really coming to listen, to have a conversation just like we're having. And then from there, I can have a private meeting with the navigator, or even I can ask for a case manager and say, I really need to talk to a case manager. And our team will then refer them to one of our internal case managers. And many times, a parent may just need to have a conversation with someone because they're lonely and they don't have anybody to talk to. And we're there for that. A lot of our case managers are young, but they're so good at what they do, and understanding that we even have other things that we do that are not guided by the grantor or by somebody who gave us the money to do this, but more we have a few groups. We have one that we call it Café con CCMP. So we bring a group of people on a weekly basis, and they'll have coffee and bread or something else, whatever they want, and they just have a conversation. It could be about the environment, out, the streets, the dirty streets or whatever, or it could be about something that they're going through. And they just offer each other advice, or sometimes just talking it out. You're not asking for help, but let me just tell you what's going on. And that has really been helpful to the women participating in those Cafés con CCMP. We began last month another group that we call it Bailando con CCMP. And I don't know if you know, but I call myself Mexican, but then there's a lot of other, Central American, other people that love to dance. We feel that dance also helps you deal with your mental health. And so we initiated this thing, Bailando con CCMP, is the last Friday of every month from 5 to 7. And all you have to do is come and dance with us. And a lot of the families who came the first month, we did it last month, I didn't think we were going to have a lot of people. Like, we didn't advertise it. It was just word of mouth. And now people like, when are you guys having this one? They want it more often, but we can't, it's just because you still have to have the team and everything. But dancing is also a form of relieving any stressor you may have. Also, because we don't charge. And, if you go to a bar or a club, you have to pay, or you go to a park, you have to pay. But if you come to CCMP, you don't have to pay anything. And you just come and be with other people who love to dance and listen to music. And we feel that we're addressing some part of mental health through that, through Bailando con CCMP, Café con CCMP, and yes.
Oh, those are beautiful. Those are great. That's absolutely right. That's absolutely right. So it happens at the community level. You do activities that are helpful to the people you serve, and it's really a community practice, ¿verdad? And what's powerful about it is that it does help a person's physical well-being and their emotional well-being.
Yeah.
Try dancing salsa for 2 hours and then tell me whether or not it helps you or not. Porque sabes que you will be moving body parts that you didn't realize had to be moved. But the
Right.
point being is that's right. It's a stress reducer. It helps reduce people's anxiety. It
Yeah.
helps people get clarity. It changes your focus. You have fun. Imagine, right? Imagine creating endorphins that you like. Porque all of a sudden you're laughing. You're laughing at
Yeah.
yourself because you misstepped or you stepped on your partner. But the
Right.
point being is these are natural processes, right? And they don't have to necessarily be some scientific approach, but though it's important, is that people can enjoy them, they benefit from them. And I love the titles, right? Cafecito con CC
CCMP.
and
Mhm.
CCNP y luego bailando con CCNP. That's perfect. Those are great examples of how we do take care of our emotional well-being, our physical
Mhm.
well-being, on top of the other things that you provide. So all I
Yeah.
could say is just very nice, and your approach to services is very important.
Mhm.
How do you engage a person? Well, you have to be one, compassionate,
Yeah.
gentle, respectful. Porque en la raza, particularly in the raza communities, and many oftentimes with many of our other cultural groups, right? I don't always necessarily much different than the Asian Pacific Islander community or African American. What we have in common, right, is the fact that we are approaching people in a way that isn't necessarily the most common approach in other organizations.
Mhm.
And so
Mhm.
kudos to you for being able to make a service available so that when people then do come forward, it's because one they can say, I can say something and feel like it stays here. It's private,
Mhm. Yeah.
confidential, and it's going to be because people care about me, right? And those
Right.
principles are just incredible. All I could say is I've just been so impressed to hear about the work that you're doing, the way that you approach people that you serve. And so, what I'd like you to do now is if you think about what you would like today's audience to take home, is what would advice or what would you like them to take away from today's Plática?
I think, like I said at the beginning, if I had known what I know now when I was younger, and just remember that there are people here to help, and never be embarrassed or ashamed of seeking help. Maybe even if you had a bad experience elsewhere, there's always also the good people. I know oftentimes we have bad experiences with governmental agencies, or the wait is too long, or by the time they help me, I've already. So don't lose hope. And there are a lot of agencies like CCMP throughout the state and the county that are there to help and are passionate about um, providing the community the opportunity to grow and be successful. And, I say that success doesn't mean having a lot of money or having the biggest house or having the best clothes, but success really, to me, means being happy and having my needs being met and the needs of my family. And as long as I can do that and provide a happy, so Bailando con CCMP is not just because we don't have nothing else to do, but I feel if you're dancing and you're fed and you have Café con CCMP, you go home and you're a happier person. Therefore, your home is going to be happier because I'm happy as a mom, or as a parent, or as the older sibling. I'm going to take that with me to my house. So take advantage of the opportunities. Don't just say, oh, I don't have time to do that today. I have to go do laundry. Laundry is going to be there by the time you get back. Take care of yourself. If we take care of ourselves as parents, as the adults, not only will we change our household, but we also going to change our community, because we're going to take the happiness with us. And a happy person is going to create a happy community. So take advantage of the free services offered.
That's right. That's right. It's a great way to say take advantage of it, because it's there, right? So,
Mhm.
so how do people get hold of you? How's the best way to find you? look for you, call you? What works best? How do people usually come to you anyway? But how do people connect to you?
So we have a general phone number, which is 213-482-8618. And I know when it gets busy, it takes a minute, but if you leave a message, we'll get back to you. We also have an email, this info@laccmp.org, and we'll always get back to you through that email as well. But also if you contact us through Facebook or Instagram, we're very good at responding to those messages through both pages. We don't have dedicated staff, but whoever sees the message on Facebook will answer within the hour, if not more often, and then address the needs. And then we'll ask, if you need to contact someone, then give us your phone number or email so that we can contact you back. But we have been very responsible to all those ways of reaching out to us.
Well, I want you to know that we put all of this information in the Facebook chat.
Okay.
So after today, when it's the recorded version, people still have the information. So we'd like to encourage you to share this with your network and your partners, and so that people can then take a chance to listen to Margarita, right? Because how many people have a chance to sit with you like this and have you just kind of share all of this? It's pretty hard to make an appointment with the executive director because they're so busy. You're very kind to give us your time today, and I want to thank the Facebook listening audience who has been joining us for the live portion to comment on Facebook. And more importantly, is we'd like to let you know that we are going to record this, post it again on Facebook, and we want to keep getting the word out so we can not only face and address stigma, but we can help connect people to services such as the work that CCNP is doing, because it really shows that the community grassroots approach is always very effective, because
yes,
you simply want to be of service to people, and you want to do it in a way that's accessible, available, affordable. Many of your programs, if not all of them, might be free. You simply are opening your doors.
yes.
Están con las puertas abiertas. You're opening your doors, and that's precisely how in communities of color, como dicen hoy en día, people can start to feel, okay, well, they're very respectful. They're not judgmental. They're trying not to make it difficult for me. They're not putting too much pressure on me. I just simply am struggling at a point in my life that when I reach out for help, I can come to CCNPC for that help. And
all of
Margarita,
our services are free. Everything is free. That we
wow.
never charge for anything.
Wow, that's amazing. Well, all I can say is if that's not accessible, I can't say what is, because oftentimes it's a barrier for many people, but you are taking down barriers, you're bringing people in, engaging them, and being of them service. So this has been an incredible plática, Margarita. And if you were to say in one word how you feel right now, what would that be?
Grateful. I am grateful for the opportunity, and I know, thank you. And I'm glad that more people will be able to take advantage of the services we offer. So the word will be grateful.
Wow, beautiful. Well, with that, I'm grateful too. Thank you to you, Margarita, as our presenter, and thank you to the folks who have taken the time to listen to today's program live, but we're also going to continue to make sure it's available in its recorded version. So please, let's give Margarita a big round of applause for having shared her time with us, shared her information about the agency, and to help tell the story about CCNP, because the work that they do is to be of service to those that are in Los Angeles city limits, and even people in the county of Los Angeles. All of that to say is, for every life that they touch, they improve their lives. So otra vez, muchísimas gracias to everyone. Thank you for being here with us today. Adios. Goodbye.
Thank you.
And thank you so much.
Thank you very much. Bye-bye.